Did you know that if we have an injury to the spine, or to any joint in the body for that matter, but let's talk specifically about the spine, that if we have an injury, that the body lays down scar tissue and the ligaments will actually change shape and become asymmetrical based upon the injury. Now, how does the body do that? The body understands that if we have let's say, we'll take this pattern. If somebody had a trauma like this and their head shifted out of position like this, and after the trauma, this was their posture, this is how it ended up. So the ligaments on one side have been stretched, and on the other side have gotten shortened. So this is their new pattern of misalignment. So because the ligaments have changed shape, that this is now how the patient is stuck. So by finding out exactly what's the pattern of misalignment, we can come up with different strategies to help free them up and get them back to the middle. Fantastic. So what are those strategies? Well, one of them is a specific adjustment that will help stretch the scar tissue, but it doesn't by itself actually change the shape. We need the adjustment to free it, but to actually, we say, remodel the ligaments, we're going to have to stretch them over a time period. Now, the research tells us that in order to get a ligament, and by the way, a disc is a type of a ligament. In order to get a ligament to change shape, we have to hold it in a stretch position for a minimum of 10 minutes. So we talked before about how important therapeutic exercises are. So if somebody's shifted like this, we know that we're going to have to do exactly opposite of that to re-educate the brain. But in and of itself, the therapeutic exercises are not going to move the body over. We know that we have to create an adjustment to free it up, but in and of itself, it's not going to be enough to move the body over. So what we do is we do specific time stretching. We call that traction, where we bring the body into a corrected position and we hold it for a minimum of 10 minutes, and that's what allows the ligaments to stretch and remodel. Now, if you look behind me, you see these traction units. What we do with every patient is we figure out what's their specific pattern, their specific direction of misalignment. If the trauma was like this and their head shifted like this, we'd create a stretching on these instruments, on these traction units, where we'd stretch the head opposite. We would hold it there for at least 10 minutes, better 15, to hold it, and little by little, the ligaments stretch so that the patient ends up in the middle again, and they're nice and symmetrical, and their bodies can heal. It's actually how oral orthodontics or Invisalign work, that they hold the body in a corrected position. Now Invisalign, they're doing it for 22 hours a day, and in a full old school braces, they're doing it 24 hours a day, and it stretches the tissue, the ligaments of the teeth back towards center. Well, in the chiropractic techniques, we do intense stretching, shorter period of times, repetitively, to stretch, overstretch it, hold it this way for 10 minutes, and the patient ends up in the middle. A patient can't hold a therapeutic exercise for 10 minutes on their own, but we can use certain in-office and home traction units to put them in a corrected position. It's stretching, they'll definitely feel it. It's not painful, but we challenge the tissue, and little by little, the tissue stretches, and the body starts to rebuild and heal the connective tissue, specifically the ligaments, so that over time, we shift, we get them back to the center, it takes the stress off the nerve system, and the body heals. Our formula for spinal postural correction is exercise, adjust, and traction. But that traction piece must have time linked to it of really, we typically do 15 minutes in office, 20 minutes at home. So these traction units allow us the time for the tissue to gently and effectively stretch so the body can come back into normal alignment, take stress off the nerve system so the body can heal. That's how we fix these problems.